Sunday morning at 8 a.m. Congratulations, that shows you have the spirit that you're going to need for medical school, so that's wonderful. And thank you, Jubin, for organizing this conference and for that kind introduction. So I hear that the trip to UC Davis School of Medicine was a tour of the highway a little bit last night. Who went on the bus tour to UC Davis? Hey, well, and you're all welcome to come take a tour at any time, just contact us. I know that those of you who did go and finally got there through the traffic jam, I hope that you had a chance to see the places that our students learn. Maybe you imagined yourself learning in places like our classrooms, the brand new library, or our clinical skills center. You know, many of you are looking at schools like UC Davis to apply to for medical education. And at this meeting, you're getting the chance to talk to many of the admissions teams, and I understand that you heard from Provost Rory Hume yesterday on some real practical advice about the kind of students that we're looking for at the University of California. And I know that the admissions teams will give you that practical advice as well as inspiration. But I want to do something slightly different. I want to ask you to think, okay, it's Sunday morning at 8 a.m., that's a little bit hard, but I want to ask you to think about yourself. I want you to just take a couple of steps back from the pressure of MCATs and grades and all of that, and consider why exactly you want to go to medical school, and why exactly you want to become a physician. Some students say they want to become a doctor because their parents were doctors, and that they admire their life's work, and they want to follow in their footsteps. Others might say it's because you always like science, and you want to use science to help people. Still, others might want to emulate a doctor who cared for them or for a family member, a doctor who eased the pain and suffering of illness. Perhaps you're saying to yourself, you simply want to help others. You want to bring hope and caring to your fellow human beings. Have you all thought of your reasons? There are a lot of reasons to go to medical school, but what I want to tell you this morning is one thing that might kind of surprise you. I believe that the most important reason to go to medical school is not to learn the practice of medicine. Rather, the most important reason to go to medical school is because you want to learn the principles and the values of medicine. Let me just explain what I'm talking about. Some of you have probably heard that the world of medical knowledge is doubling at an ever-increasing rate. Estimates today say that it only takes 5 years for everything we know about medicine to double. Now think about what that means. That means from today until the time you get your medical degree, there will be at least twice as much to learn. And you know what? You will even learn a lot of things in medical school, quote-unquote facts, that you will then have to unlearn, because medicine has changed so much that those things are no longer true. So the most important thing in medical school is not the facts. It's to learn how to learn, and it's to learn the values and principles of medicine. Think about this. There are medications today, prescriptions, that will no longer be available by the time you graduate. There will be new clinical skills that are adopted as best practices in place of old ones. There will be a whole new world of medicine in which innovative technology and advances in things like computers will transform how healthcare is delivered. So the practice of medicine will shift and change continuously over the course of your education and your career. So, as you are looking at medical schools to apply to, and that's one of the things you're doing here today, I hope and I urge you to ask the right question, because the right question is not, is this the best place for me to learn the practice of medicine? The right question is this the right place, the right school for me to learn the principles of medicine and the values of medicine? So how are you going to find the best place to learn those principles and those values? Applying to medical school is a two-way street. I believe, and I think by virtue of the fact that you're here, you believe, that each prospective student should interview the school as much as the school interviews you. And so I hope you know that you have the power, you have the responsibility to ask some really tough questions. Let's just take one. How many of you, raise your hands now if you agree with this, how many of you think that we need to reduce health disparities among minority and underserved populations in our communities? All right, you've just talked about one of your values, one of your principles of medicine. And you know what, by the way, since you're interviewing us, that lines up really nicely with our commitment to UC Davis. Why? Just think about this. The rates for diabetes, for smoking, for childhood obesity, and other health problems disproportionately affect some communities and result in poorer health. And you know what health disparities means? That those differences happen on the basis of race, ethnicity, socioeconomic status, geographic location. This is an unacceptable failure of our current healthcare system, It is particularly reprehensible when you consider that the United States is the richest country in the world. We spend the highest percentage of our gross national product on healthcare, and we still have health outcomes which lag far behind other countries. And we have health outcomes that are one thing for the privileged and another thing for the marginalized in our country. Those are not the values that we want in the field of medicine. Medical schools are in a position to address health disparities, and I suggest that when you go interview medical schools, you should ask them, what importance do you place on reducing health disparities? What resources do you, as a medical school, apply to reducing health disparities? How much time and effort does your school devote to reducing health disparities? And those answers, the answers to those tough questions that you ask, they'll help you determine if that school lines up with your values, the values of all of you who raised your hands. Here in Sacramento, our medical students run 5 free health clinics for people in underserved communities. One for predominantly the African American community, one for Latinos, one for Asian Americans, one for the Muslim community, and others. And Dr. Ron Chan, just wave your hand, Dr. Chan in the back, he runs helps run one of our student-run clinics, so you can talk to him afterwards. By taking an active role in our community, our students at UC Davis not only become better doctors, but they learn, they know that part of being a doctor, part of becoming a doctor, is reaching out to our most vulnerable patient populations. It's practicing the principle of wanting to reduce health disparities. Reducing health disparities isn't necessarily something that you will have the chance to really learn about in great depth at every medical school. But I believe that it's one of the most important principles of medicine, and I hope you look for a medical school that embraces its importance. And there are many schools represented here at this conference who do that. In addition to learning the importance of reducing health disparities, I also hope you look for a medical school that believes in another principle, and that's the principle of social justice. I also hope you look for a medical school that believes in another principle, and that's the principle of social justice. There are some very unsettling, some very wrong statistics out there. Think about this. At least 47 million Americans have no health insurance. That's nearly 1 in 6, and here in California, 1 in 5 people don't have health insurance. These are our friends, our neighbors, our family members. They don't have a doctor they can call their own. That's a huge problem. You guys are part of the solution to that problem because you want to become doctors, but people have to be able to pay for it too. So I bet you've been listening on the news about some of the discussions, if you're from California, in the state legislature about healthcare reform. There are a lot of people trying to improve healthcare. In fact, in Sacramento, our Governor Army, our legislators, they've stayed at the Capitol for a special session to try and enact healthcare reform. Some of them want government to expand services and provide healthcare for everyone. Others say that the private sector should take a stronger role. And many, and perhaps most, advocate a combination of increased responsibility for individuals, employers, and government. Regardless of where you come out on healthcare reform, we have to do it differently. But there are 2 major challenges in healthcare reform right now. First, there are a lot of groups out there with competing interests. By that I mean everyone from insurance companies to pharmaceutical manufacturers to hospitals and physicians. And you know what? Too often, those individual agendas mean that we all forget where the focus should be. The focus has to be on what's best for patients. The second problem is even bigger. There simply aren't enough doctors, nurses, and other healthcare providers. There aren't enough patients sitting at the table when these important decisions are made. So, when you're looking for a medical school, I hope you ask questions about how you get involved in areas like health policy and advocacy. Groups like AMSA are a great place to start, and you should always ask what opportunities are available at the school that you're interviewing, the school to which you're going to apply. What other values should you look for in choosing a medical school? In addition to a place that teaches the importance of reducing health disparities, the importance of social justice, I think that you should look for a place that teaches you that becoming a doctor isn't about what you get, it's about what you give back. I know that many of you are taking loans in order to go through college, right? And many of you will have to borrow even more money to go through medical school. And it's understandably tempting to start worrying about money and debt. But it's important for you, I believe, to view these costs as an investment in your future, and most importantly, an investment in your community. It's important for you to remember that the goal of going to medical school is not to make money, but to make a difference. I hope that your college and your medical school experiences teach you a very important principle. The success of your practice, your hospital, your clinic is not defined by how much it makes, but by how much it gives back. This is the principle of social responsibility. It means that individuals like you, especially in fields like medicine, should embrace your role to make our communities a better place. Hospitals like UC Davis, which serve the underserved, believe in social responsibility. We are dedicated to promoting the health and well-being of our community. And you know what? Financially, it's not easy to provide millions of dollars of uncompensated care every year. But we do it. We do it because we know it's the right thing to do. So no matter where you choose to practice or which specialty you choose, I hope you will always find ways to give back to your community. And I hope that the medical school that you interview and in which you enroll teaches you the importance of embracing social responsibility. In sum, when you finally reach that day and you receive your MD, sounds good, doesn't it? I hope you will say that medical school taught you much more than just the facts about the practice of medicine. Because the practice of medicine will continue to change at an ever-increasing pace, what is so much more important is that medical school will have taught you the principles of medicine, the values that will guide you through your lifelong journey, because those things won't change. I urge you to hold fast to the principles I have just described: reducing health disparities, advancing social justice, and embracing social responsibility. If you do those things, I know you will find the answers that help patients everywhere. And as you progress through medical school in your career, I hope you will remember those values in your classrooms, the clinics in which you practice, and the community in which you live. A woman named Jane Addams knew the importance of these ideals. She was an activist in the late 1800s and the early 1900s. She was the first president of the Women's International League for Peace and Freedom. And she said this: "The good we secure for ourselves is precarious and uncertain until it is secured for all of us and incorporated into our common life." In 1931, she won the Nobel Peace Prize. So today, my charge to you is to secure a greater common good for your patients, for your communities, for our world. And I know you can do it because you've taken the time to come to an event like this where you are sharing your ideas and talking about the future of medicine. I know you will be a part of the future of medicine, and I want to thank AMSA, American River College, and Juman for having me here. I wish all of you the very best of luck in your future. Have a great conference.
So I was wondering, does anybody want to ask Dr. Pomeroy any questions? Anyone?
So the question was, what is the advice to women to become a strong leader? And this is the advice for women, but it's the advice, I think, for everyone, which is define your values. Define what you believe in, and then make sure that you make every decision based on those principles. Too often, it's easy to make decisions about where you want to go on the basis of expediency, or some people on money, or those kind of things. But if you know your values, you will make the right decisions. Second point, time management. Okay, we've gone from the high level to the practical. You all multitask all the time. If you want a career in medicine, and this is especially true in our society for women, you will have multiple competing demands on your time. You've got to learn to prioritize. I believe in making lists. I believe in today goal lists, the week lists, and the month list, and the year list. Write them down and tick them off. If it's down on the list, you don't have to have it running around in your head because it's down on the list. So whatever little tools you can come up with for time management, that's really, really important. Sometimes it's very easy to put the big stuff off. And so say you have a big paper to write. It's easy to do the small stuff and keep putting off the big paper. Well, take the big paper and divide it up into smaller chunks on your time management lists. So there's some real practical things that you have to do because you will have competing demands on you. And believe it or not, as busy as you feel now, they'll get even more so. And managing those and setting your priorities on the basis of principles. Thank you for the question. Yes? So the question is, what obstacles have I faced in my career in medicine? So one of the things that I now talk about is the fact that I grew up in sort of a different scenario. I was a foster kid. And I can tell you that growing up in foster care is the hardest thing that I ever did. Everything now is easier than that. And so believing in myself when I was in those circumstances was probably the biggest barrier. There have been times when I got treated differently because I was a woman. That will happen to all the women in this audience at some point in their career. And what you have to do is you have to keep your eye on the prize. Remember what your goal is. Remember what you're striving for, because it's all going to be worth it. I want to end, though, in answering the question by saying that the obstacles that you face are not predominantly because they're inherent in the challenges of becoming a doctor or becoming a leader. And they will be faced by all of the people in this room. And so one of the really important things is to look around at your colleagues, people sitting next to you in this room today, and to support each other. By believing in all of us, we will make it easier for all of us. Yes, please. So the question was about UC Davis and what we're doing about geriatric care. And this is a huge problem in our society today. And one of the values that we put in our strategic plan is to emphasize lifelong care and understanding that the type of medical care that babies need is different than adults, which is different than older folks. And so we have emphasized geriatrics. We have a geriatrician, Dr. Michael McLeod, who is a very inspirational leader. One of the realities is that very few physicians go into geriatrics care. So if by virtue of your question, that's something you're interested in doing, that would be something that we would value. Geriatrics care is frankly not well reimbursed. It's complex because people have multiple chronic diseases, which is very hard to manage all of those aspects of aging. So I think it's a great question. I would urge you to talk to Dr. McLeod about the things that we're doing in geriatrics. And it's something that we as a nation and as a field of medicine have to really talk about how we're going to make sure that people like me, the aging population, get the care that is so needed. So our student-run clinics actually involve undergraduate students at UC Davis as well as medical students, and they're supervised by the faculty like Dr. Chan. And you have to apply. It's very competitive. Lots of undergraduate students want to do it. So there is a process for doing that. You can contact the students. The medical students actually screen the applicants. We also have volunteer opportunities at UC Davis Medical Center and UC Davis Health System and School of Medicine. And those go through our volunteer office. And so those of you who are interested, those are also very competitive. More people want those kind of opportunities. But you should contact us and we'll try and match you up. And Jubin, as usual, is way ahead of the game. And there is a link on the website if you sign up for the conference email today. Yes? So one of the questions is, what role will complementary medicine, or sometimes called alternative medicine, we like the term complementary better, play in the future? This is something that we're very actively exploring at UC Davis. I see this very much expanding at all schools. For instance, our anesthesiology department has a major interest in acupuncture. That's something that we offer. Our physical medicine and rehabilitation folks have an interest in mind-body connections, biofeedback, those kinds of things. And I think when the NIH developed an institute to look at real studies of complementary medicine so we have evidence-based answers about what really works, that was a huge step forward. Clearly the public wants complementary medicine. This is something they're willing to pay out-of-pocket dollars for. And so since the focus is on our patients and what works for them, I see this as an expanding area, and I see it as responsibility of universities like UC Davis to find the parts of complementary medicine, just like we find the parts of traditional medicine that work, and to give that information to the public so they can make great decisions. Maybe one last question? Yes? Yeah. Yeah. The question was about international students. So at the University of California schools, we have traditionally taken predominantly in-state students because of the funding mechanisms. I think that the most important thing is we want the best students, and so the international students are very much encouraged to apply. One of the things we're doing at UC, and perhaps Dr. Hume talked about this yesterday, was an increasing emphasis on global health. And I think that we understand that there's great expertise from everywhere, and so we urge you to talk to Dr. Henderson, and bottom line is, if you're the best, we want you. Thank you very much. Have a great conference.